Hi Ashley, my name's Lauren and I'm a student nurse and I'm going ahead and be doing a head-to-toe assessment on you. Is that okay?
Yes.
Okay, I close the curtain, perform hand hygiene. Let me go ahead and see your bracelet. Can you go ahead and tell me your name and date of birth?
Ashley Soto, 11/08/1999.
Okay, thank you. I'm going to start off with taking your vitals. Are you having any pain right now?
No.
Okay. Okay, can I go ahead and get your wrist so I can take your pulse? Your respirations and pulse are good. I got about 35 for 30 seconds, so around 70 is your pulse rate. Let me go ahead and take your blood pressure now. Is that too tight?
No.
Can you just uncross your legs, please? And relax your arm. Okay, blood pressure looks good. I got 122/86. Thank you. Okay, I'm gonna go ahead and assess your head and face. Is that okay?
Yes.
I'm gonna go ahead and assess your TMJ. Can you open your mouth? Close? Open? Close? Does that hurt?
No.
Okay, when I percuss your frontal sinus, does this hurt?
No.
Your maxillary, does this hurt?
No.
Can you go ahead and puff up your cheeks? Can you stick out your tongue? Squint your forehead? Smile? I'm gonna go ahead and check your sensory. Can you close your eyes? Tell me if you feel this.
Yes.
Tell me if you feel this.
Yes.
Tell me if you feel this.
Yes.
Okay, perfect. Now I'm gonna go ahead and check your eyes. Does this hurt when I touch your gland?
No.
Okay, I'm gonna go ahead and have you cover your right eye first. And go ahead and read the sentence.
The dog jumped over the fence trying to escape his owner.
Okay, go ahead and switch eyes. Tell me if you have any difficulty.
No. The dog jumped over the fence trying to escape his owner.
Okay. Now go ahead and follow my finger. Okay, now go ahead and look at the painting at the distance. And then I'm gonna go ahead and put my finger in your vision and go ahead and focus on my finger.
Okay.
Okay, one more time. Okay, now look at me and you're gonna go ahead and tell me if you see my fingers and how many fingers.
Okay. 2.
Oh, keep looking at me.
Oh. 2. 2. 2. 2.
Now I'm gonna go ahead and move my fingers towards our center and you're gonna tell me when you see it.
Okay. Now.
Okay.
Now.
Okay.
Now. Now.
Okay. Now I'm going to go ahead and check your pupils. I'm going to point this light at your nose and go ahead and see your light reflex. Okay, even. Okay, I'm going to go ahead and assess your ears, nose, throat, and neck. Keep your eyes closed. I'm going to go ahead and whisper, and you're going to repeat what I say.
2, 7, 8,
1.
1.
I'm going to go ahead and check your nose, see if everything's equal, no abnormal findings. Can you go ahead and open your mouth for me? Stick out your tongue. Go ahead and say ah. Can you pronounce light, tight, dynamite?
Light, tight, dynamite.
Okay, now I'm going to go ahead and assess your neck. Can you go ahead and move your neck to the left? Move your neck to the right? Can you go ahead and flex your neck? Can you hyperextend your neck? Okay, let me go ahead and put my hands on your shoulders against resistance. Can you shrug? Okay, good. Let me go ahead and check your carotid artery, trachea, thyroid, everything feels normal. Now I'm going to go ahead and palpate your lymph nodes, your preauricular, postauricular, occipital, tonsillar, submandibular, submental, cervical, posterior cervical, supraclavicular, and interclavicular. Does everything feel okay? Does anything hurt?
Yes.
Now let me go ahead and auscultate your carotid arteries and your thyroid just to check for any bruising.
Okay.
Okay, everything sounds normal. I'm going to check your capillary refill. I'm going to check your ulnar pulse and your radial, your brachial. I'm going to go ahead and palpate your epitrochlear nodes. Let me go ahead and see this arm. Capillary refill. Your pulses. And your nodes again. Okay, can you go ahead and push down on my hands? Can you go ahead and pull up? Can you push inwards, outwards? Can you flex your wrist, extend? Can you rotate your wrist? Can you push out your arms, rotate your arms? Put them above your head, bend your elbows, extend. Does anything hurt?
No.
Okay, let me go ahead and have you stand up, and I'm going to assess your back. Spine looks good. Can you go ahead and lean forward a little bit? Okay, you can lean back. I'm going to go ahead and percuss. Can you go ahead and say 99?
99.
Again?
99.
Again?
99.
I'm going to go ahead and also take your breath sounds. Can you take a deep breath with your mouth? Okay, let me go ahead and inspect your chest. Everything looks symmetrical. Let me go ahead and palpate. Do you feel uncomfortable or does it hurt?
No.
Okay, let me percuss. Does anything hurt?
No.
Okay, let me go ahead and listen to your chest wall, starting with your aorta and your pulmonary, your herbs, the tricuspid valve, and lastly the mitral valve. Okay, everything sounds good. Let me go ahead and check your jugular veins. Okay, they're not distended. No abnormal findings on both sides. Okay, if you could lay down here. I'm gonna go ahead and check your abdomen. I'm gonna also take your bowel sounds.
Okay.
Bowel sounds are good in all 4 quadrants. I'm gonna go ahead and percuss for tympani. Does anything hurt when I lightly touch it?
No.
Okay, I'm gonna go ahead and put a little bit of pressure. It should be uncomfortable, but it shouldn't hurt.
Okay.
And then lastly, deep pressure. Tell me if anything hurts. Okay, I'm gonna go ahead and check your inguinal lymph nodes and your femoral pulse. Okay, let me go ahead and inspect your lower extremities. I'm checking for temperature and edema. Everything feels normal, no edema present. Let me go ahead and check your pulses. Popliteal pulse, tibial, dorsopialis. Okay, on this arm, leg, popliteal, tibial, dorsopialis. I'm going to go ahead and have you close your eyes, and I'm going to touch the bottom of your foot. You're going to describe the feeling to me. Okay.
Yes, and it's soft.
Okay, on this foot.
Yes, soft.
Okay, I'm going to go ahead and assess your muscle strength. If you could go ahead and push against resistance. Can you extend your legs? Can you flex them? Can you rotate your ankles? I'm going to check your hip strength. Can you push in? Can you push out? Can you adduct your hips towards your body? Adduct. Same thing with your ankles. Adduct, adduct. Okay, does everything feel okay? Are you in pain?
No.
Okay, now I'm gonna go ahead and check your neurological system. If you can go ahead and close your eyes, I'm gonna hit your foot with either 1 or 2 pencils, and you're gonna go ahead and tell me if it's 1 or 2.
Okay.
Okay, go ahead and close your eyes.
2.
And then on this foot.
1.
Okay, if you could close your eyes and put your finger to your nose. Same thing with the other hand. Okay, if you could go ahead and do rapid hand movements on your... Perfect. Can you stick your palms out? I'm going to go ahead and put an object in your hand, and you're going to go ahead and describe it for me.
A coin.
Okay, and then on this palm?
A coin.
Now I'm going to go ahead and write a number on your hand, and you're going to describe it.
1.
Okay, and this one?
2.
Perfect. Now I'm going to go ahead and have you stand up. We're going to go ahead and check your balance with the Romberg test. If you could close your eyes, stand still for about 15 seconds. Let me go ahead and see if you sway or not. Okay, go ahead and stand at the end of the wall and walk towards me normally. Okay, now walk backwards. Now I'm going to go ahead and have you walk from heel to toe in a straight line. Okay, thank you, Ashley. this concludes your head to toe assessment. All your findings were within normal limits, and thank you for cooperating with me.
Okay, thank you.